Good morning, Illini. Welcome back. This is Healthy Illini Podcast, and I am your host, Matt Sherrock. And we're starting the spring semester. Classes are starting, and somehow we're already here. 2023, which sounds very strange to talk about, but we're excited about the episodes we have lined up for the spring semester. And today's episode is really important to the campus, but I also feel a lot of weight with this one. So we want to get right into it and jump into the topic. Today, I'm joined by two guests, and we're talking about Narcan. That was something that was in kind of the news and in a lot of emails that went out to students at the end of the fall semester because of some developments on campus and some opportunities, and we'll talk about that. But I'm joined first by Joe Trotter. He is the Harm Reduction Program Coordinator with the Champaign-Urbana Public Health District. Joe, thanks for being here today.
Thanks for having me.
We're also joined by a student here at UIUC. Olivia O'Donnell is a senior in kinesiology. She is also a member of the Illini women's gymnastics team. And Olivia, I appreciate you coming in too.
Thanks for having me.
So we're going to start off a little bit with some almost technical discussion, because just as a jumping off point. I'm really grateful for both of you to be part of this discussion, and you both have very important perspectives to share. Joe, you have a little bit more of the technical knowledge. Olivia, you have a bit more of a personal story. So we'll get to that conversation in just a moment. But let's start with what Narcan is. It's been a topic of conversation, as I said. But for a lot of us, including myself, Narcan is kind of just a word. I kind of have a peripheral knowledge of what it is, but I don't really know what that means. So Let's start with what is Narcan, and why was that announcement of availability on campus so important?
Yeah, so Narcan it's a medication that's used to stop an opiate overdose that's in progress. So when someone uses more opiates than they can handle at that particular moment in time, that triggers an overdose, which slows the body down too much that the person's not able to ask for help, or it's really, really hard for them to ask for help. So what Narcan does is it basically prevents the opiates from doing what they're doing, and then allows that person to be rescued. So it's a very kind of simple, easy to use, very safe medication that's been around for a really, really long time. We know that opiate overdoses are increasing all across the U.S., and we're no exception here in Champaign County. So part of my program is to help get Narcan out into the community, and we're casting a wide net with that, meaning that we want to get Narcan out to anybody that wants it. So what was really great about this particular announcement about Narcan was we saw a need to get Narcan out into the hands of students. To know that there's availability, so that they know that there's an availability for them. And so working with McKinley was really great for us to say, okay, this is a route that we can use to help Narcan get distributed to the student population, to the campus population. And so, we're real excited about increasing access, increasing ease of access. So, Narcan can be purchased over the counter in Illinois. It can be picked up free from a program like ours at Public Health, but there's never enough good places to put Narcan. So the idea is we need to distribute it widely, make it widely available to people, and make it as low barrier to access as possible. So the thing that I'm really, really excited about with this, not just that it'll be an ease of access for student populations, but also that they can get it from a vending machine at Eikenberry building, which is really, really cool. That means you don't have to talk to anybody. You go up, you scan your card, you hit a couple buttons, you get a kit of Narcan. And so that's that ease of access thing that we're talking about here. And so when we're talking about overdoses and opiates, we're talking about drugs. So, we're talking about very specific type of drugs that have a specific effect on the body, which can trigger an overdose. And opiates are in the news a lot. Fentanyl's in the news a lot because it's a very potent type of opiates that's out there. And when someone has an overdose, they can't save themselves.
I was going to say that's kind of the important part of this conversation, is that this conversation is for everybody.
Yeah.
If we're talking about if we do a podcast on training with free weights, and the proper way to use free weights, that's pretty specific to people who use free weights.
Right.
And with this, everyone needs to know, because there may be students who are using opiates or have access to opiates, that they need to know what's going on. But it's also important for people who's like, well, I don't use it, but you might be around someone who does.
Exactly.
Because like you said, if someone's having an issue with an overdose or, their body's reacting, they can't do it themselves.
Right.
It's the people around them, the bystanders, the friends, the passerbys who really have to be the ones to administer.
Yeah.
So that's everybody.
Yeah.
Because, at any moment I could walk by anybody on campus who has a medical emergency. And if it involves opiates, I need to know about Narcan.
Right.
I need to know what it is, how it's used, that sort of thing. So this is really an all-encompassing conversation for everybody.
Yeah. And the one important thing too about this type of medical emergency is that, and that's a good way to describe it, is that it's a medical emergency. And time is of the essence in any kind of medical emergency, but with opiates in particular, with an overdose on opiates, there's a very small window of time that someone has to be saved. So we don't have a whole long time to respond to them, meaning that it's still important to call 911. It's still important to get medical professionals there as fast as possible, but sometimes they can't get there fast enough through no fault of their own. So the idea with something like Narcan is that you can get this, life-saving medication into someone quickly, because that's the time is the biggest problem here when we're responding to this type of emergency.
There's a lot of talk on college campuses especially, but in a lot of areas that, when you go out, you're with friends, to be aware of, watch your drinks, watch your food, that kind of thing. Are opiates something that you could be slipped and not even know, and you start having reactions? Is that a risk?
Not necessarily slipped. It's more that when a drug is prepared for use, whether it's prepared for use like on the street, so drugs that are purchased on the street, often there are things subtracted from them, things added to them. And so with fentanyl being a really classic example that we're seeing now, of fentanyl being added to a drug, so it looks like one drug, but it also contains a trace amount of fentanyl, which is a strong opiate. So, it's not so much that, people are getting slip drugs that they don't know what it is. It's that they're taking a drug and they don't know how strong it could be. So we have this fluctuation in the drug supply of how strong it's going to be on any given day. So then someone might be taking a pill that they've taken several times before. They know what it is. They know how their body responds to it. But on this particular day or time, that pill is stronger than they expect. When that happens, kind of signs and symptoms that we're looking for are the kind of early warning sign that I always talk about is lack of response. So that's when someone is in a state where they cannot respond to you. They can't necessarily look at you or speak to you or respond in any attempt to kind of wake them up. That's an early warning sign that something is wrong. Now, when you come across someone, you're not going to know their medical history. You're not going to know what they've taken. So the great thing about Narcan is it only works if there are opiates present, but it's safe to put in someone regardless of their medical condition. So you can put it in someone, even if it's a heart attack, a stroke, seizure, alcohol poisoning, it doesn't matter. You can put it in them and at least eliminate one of the possibilities. And this is what EMTs do now as kind of standard practice when they come across someone that's unconscious, is that they'll simply put Narcan in them first in case it's an opiate. And even if it is something else, it's not going to cause any harm to them. So the idea is we want people to be aware of the potential that can be around them and make appropriate, safe attempts to try and save somebody.
You're talking about putting Narcan in them.
Yeah.
So my question is, how do you administer Narcan?
Sure.
Because, and correct me if I'm wrong, but I believe there's different ways.
There are,
different ways depending on who has it, and like what the students have versus medical professional, that sort of thing.
Yeah.
But how do you administer Narcan, especially the ways that are available that are now on campus?
Yeah. So the way that's on campus is a very simple nasal spray device. So it's just got a little plunger on it, kind of looks like any kind of like nasal irrigation, sinus relief kind of device, but it gets inserted into one of the nostrils. There's a little plunger that gets depressed, and that turns the liquid inside into a mist that gets absorbed into the mucous membranes of the nose. So they don't need to be breathing for the medication to work. It just gets absorbed in their nasal cavity. and it works within a few minutes. So it's fairly quick to work. They do have injectable forms of Narcan, but that involves a needle, that involves having something sharp, and that can be a big barrier for a lot of people. So the idea with this type of Narcan is that it's really, really easy to deploy. It's really, really safe to deploy. We also then need people to have it on them in order for them to deploy it. So, the issue is, let's say, for example, with like a heart attack, if you think someone's experiencing a heart attack, you got to run and find the AED, right? And so we have AEDs in all kinds of locations, all over campus, all over the city, because we know that that's a safe, fast way to respond to someone with a heart attack. This is the same type of concept with overdoses, is that you need to have the safe, effective kind of intervention available, widely available, so that way someone can quickly grab a kit of Narcan, spray them in the nose. Maybe it's an overdose, maybe it's not, but at least you can make that reasonable, safe attempt to save somebody.
And you did already mention, because I want to talk about where they can get it, because it's available on campus, that it is available through the vending machine in Eikenberry. That's a SDRP. That is available to students. They can swipe their card and they can get that. You can also get it at the HRC in the basement of the Union.
Yep.
That one, staff and faculty can also get it there, because it's a slightly different way of tracking and distributing there. So staff and faculty can pick it up at the Union. Students can get it there as well. And McKinley is looking actively in conversations of expanding the vending machine program in the spring, looking to bring 2 or 3, hope even more if it can be worked out, and locations to be determined yet. But there'll be more coverage for that availability, because this is something that campus is passionate about, that the health district is passionate about, McKinley is passionate about making making Narcan available, and that students know and they have it with them, so that if forbid this happens, but if they come across a situation, that they have the resources available just on their body.
Yeah, and I think it's also worth noting that this is also, opiates are very stigmatizing. When we talk about drug use, it's a very kind of stigmatizing type of topic that can be really uncomfortable for people to talk about. And the idea with creating an ease of access for someone to get Narcan is that, if they're going to one of these sites to get Narcan, no one's going to be assessing with them, are you a good candidate to carry it or not? So it's like, okay, you need a kit of Narcan? Great, we'll get you a kit of Narcan. So no one's going to be asking, like, is this for you? Right. Is this for your friend? Who do you need this for? Because often that kind of thing can happen when someone's getting condoms or getting medication or things like that. So I really want people to hear that the idea is not to hinder you from getting that kit of Narcan, to be prepared in case an emergency happens nearby you. We want to try and eliminate as many barriers as we can. And I should also add, too, that Illinois has specific laws in place that are specific to the use of Narcan, that offers legal protections for people when they use Narcan. Following in the Good Samaritan law now has specific words in Narcan, meaning you're not held liable if you're making a reasonable attempt to save somebody's life. A lot of people are concerned, am I going to get in trouble for carrying this? Is something going to happen if I'm going to carry this? No. Anyone in Illinois can carry Narcan and use Narcan on anyone at any time for any reason. So Illinois is way ahead of a lot of the U.S. in having these legal protections set in place in order to help with this ease of access issue, because we're talking about a highly stigmatized topic when we're talking about drug use.
Yeah, absolutely. I really appreciate, Joe, you taking the time to share the logistics and the basics of Narcan and kind of lay a foundation for it. I do want to turn the conversation slightly and bring Olivia on.
Sure.
You're still involved in the conversation, but I do want to kind of direct it towards Olivia and let her share, because Olivia, you are a student athlete here at UIUC. You're a senior. You've been here for a number of years. But you, unfortunately, have a personal connection to this conversation. So I'm just going to kind of turn the mic over to you. And would you share a little bit about the journey that you and your family have gone on in the past year?
Yes, definitely. So this May, unfortunately, my brother Simon passed away at the age of 23. He was an amazing brother, an amazing friend, such a talented person. He really had a passion for music. He was an amazing drummer in a band. He just had lots of passion for life, for friends. He had just been in a job for about a year working at CDW in Chicago as a sales representative, but his main passion was music. And he just really had the biggest smile, and he lit up any room. He was a very big extrovert, and I feel like whenever he was in the room, he just would throw your arm around you and just make everyone smile, and he just made you feel present and just was the least judgmental person. So I miss him every day, and unfortunately he passed away because of fentanyl poisoning. And he was alone when this happened, so he did not have access to Narcan, but he knew about fentanyl. He knew about this crisis. It's becoming more of a concern every single day. So he even tweeted about a year ago saying, like, please be careful, friends. Like, anything you buy on the street has a chance of being laced with fentanyl. I hate seeing people die. I hate fentanyl. So he was very aware of this epidemic, but unfortunately, you just never know when it could happen to yourself or those around you. So unfortunately, he passed away in May. And recently, since then, me and my family have just been very passionate about educating others about fentanyl and what you can do to help. And yes, with this administration of Narcan on campus, we were just very happy to hear, because like Joe was saying, we don't want this topic to be stigmatized or have judgment surrounding it, because it's so important, and you just never know when this could happen to you, whether you use recreational drugs occasionally or it's just experimental. One pill can kill. So yeah.
And I know your family is very passionate about this, because when the announcement went out that Narcan was available, you actually contacted us.
Yeah.
This is one of the unique situations where we didn't go looking for a guest for a podcast. And guest came to us.
Yeah.
We were already thinking about having this conversation, because we knew that it was a topic that we needed to spread awareness about and things like that. But you contacted us. We were able to make this connection and have it go. But you did say something that kind of triggered a thought for me, that, you know, college students, well, all of us really, but especially college students, we tend to feel a little invincible, that we hear stories of accidents or financial hardship or whatever it may be, and we say, well, that won't happen to me. But falling into that trap means we're often not prepared. And I think that's something that in communication with you and your mother was that your passion really is to be prepared.
Yes,
be
exactly.
awareness. So looking back on your story, are there moments where you're like, well, I wish we would have been more prepared for this, or I wish we would have had more knowledge of this type of thing? Is there something that you look back now and say, I want to spread that to others because that's something I wish I would have known?
Yeah. I had heard a little bit about, I mean, I had known about fentanyl, but I didn't really realize how widespread it was becoming. And just, it's now like the leading cause of death from ages between 18 and 45 right now in the U.S. And I'd never heard of Narcan before, Simon. So I think to know that all these facts about how easy it is to use, how it doesn't affect, it's never going to negatively affect someone if they don't have an opioid overdose occurring in their body. I think those facts are very important to know. And just hearing that, it's like so clear to me that it should be like available wherever on campus because of these, because it's just so easy to administer, and it should be available more widespread on campus. When I think about recreational drug use, I feel like fraternities could all use a Narcan kit. My mom recently went to a fentanyl national board meeting in Chicago for people who have lost loved ones to fentanyl, and she heard lots of stories, and people have been, especially like young mothers and other college campuses who have lost their children, they've been working on getting Narcan kits in dorms as well, because you never know when you might need it, like you were saying, and just to have it available in places that are highly congregated with people can be very important. So I would love to see it more widespread across campus, and I think it's great that the vending machine is awesome too, because you can just go up and get it without really having like the stress of talking to people, or just, you don't want that extra just stress, of this is a very serious topic. So to be able to get it easily in school is just great. Yeah.
And really the distribution that we're talking about and having as many people as possible with supplies as they keep coming, having as many people as possible to have it, it's almost like the conversation you have with like herd immunity. In that, it's really not necessarily, if we can have it widespread, if everybody can have it, then you can cover a lot of bases. And you cover a lot of situations, and it's not necessarily that, this is an area that we're like, here we think it's going to be a problem, or here it's a risk. It's just wherever you go, you kind of have protection. And that's really what we're shooting for, what the campus is shooting for, what the community is shooting for, to try and combat the dangers and risks of this.
Right. And Olivia, thank you for sharing your story with us. I mean, it's all too common, unfortunately, but I really appreciate, and I just want to honor, your willingness to come and talk to us about that. And I am sorry for your loss.
Thank you.
It's one of those things that most people aren't aware of. I mean, I've been working in this type of field for a really long time, and I get, I'm a little maybe desensitized to the topic, in some ways. So, having your voice here, I think is really important. The kind of recreational drug use, it's a really great topic, I think, when we talk about not just overdoses, but college campuses, because we know it happens. I mean, it's just known that it happens here. And, the message is we're trying to raise awareness about the risks, and also to be able to kind of like have each other's backs in a situation like this, because if someone uses a drug and they are having an adverse reaction to it, someone has to be there to help them. And if someone can't be there to help them, it can be, life-threatening. And when someone is in the process of an overdose, they can't call for help on their own. They can't put Narcan. It's really, really hard to put Narcan in yourself if you feel that something's wrong. So there's a need for people to also communicate with each other about the drugs that they have, the drugs that they're using, where they got them. Having Narcan available is very good. But there also needs to be better conversations about like, hey, I'm going to try this tonight, and I want someone to hang with me in case I have some kind of reaction to it, to make sure that I'm okay. And because drug use is so stigmatizing and so, immediately we begin to think about the laws and people shouldn't do drugs and don't do drugs and all this kind of old messaging that we know it's proven to not work. So the message, we've known for years that just say no doesn't work.
Right.
So what do we need to do then? And I think we need to say, okay, you want to use this, but let's be aware of the risks.
And I think that's partly why we started Healthy Illini, is to start the conversations.
Yeah.
Whether it be this topic, we've got, a year's worth of topics we've had, and it's all about starting the conversation and destigmatizing whatever conversation that is. Some are easier than others.
Sure.
But it's all about having that communication. That's so key. And Olivia, I want to echo what Joe said, that when we started this conversation, I was very cognizant of the weight of your experience, and I wanted to honor and be respectful of all of that, and have you share your voice and offer my sympathies and condolences. I can't even begin to imagine the journey you and your family have been on, but I appreciate you coming, because you are starting the conversation, because you are sharing in an open and honest way and inviting someone to come and talk to you about it. And that's really where it starts. And I think, correct me if I'm wrong, but I think that's where your passion is to start the conversation so that people are aware.
Yes, definitely. I know Simon would be proud of me for doing this, and I just want, people to not feel alone or feel like they have anything going through, or anything that they're going through that they can't share with others. And I just would love for more people to have more awareness and be more educated on topics like these without feeling like they have to be shamed or judged for speaking out about it. Because this is like the worst pain ever, and nobody should ever have to go through losing another loved one to this epidemic. And So yes, I'm just very passionate about getting more education on the risks of any street drug that you can take can be laced, and how more popular this has become, and just how dangerous it is. And I like what you said, how it's just great that instead of just continuing the conversation basically, and hey, I'm gonna try this, but I want you to be there. It's all about being there for each other and have each other's backs,
Right.
because life is hard and everyone's going through their struggles. So the more we can be there for each other, and the more we can be open about just everything, the safer I feel like we're gonna be. And that's why I wanted to come on this podcast too. Yeah, and just kind of share everything.
And that fits in exactly with what my passion is for this podcast, is that joining people on their journey and being a part of it. And it's not very often that I speak directly to a listener, but I'm speaking directly to listeners right now, that no matter what you're going through or what you are doing, it can feel often that you're alone. It can feel often that no one understands, that if I reach out, no one's going to get it or no one's going to care, especially with the harder topics to go through. But no matter what you're dealing with in any situation, whether it be relational, emotional, mental, spiritual, physical, whatever it may be, there is someone on this campus who cares. That we have a ton of people on this campus who care about students, who care about each other. Reach out. If nothing else, contact us here at Healthy Illini. Myself, Jen Carson, who does a lot behind the scenes, we will talk to you. We care. We will find the resources. We will help on that journey as best we can. Do not let the shame, do not let the uncertainty, do not let the past bad experience be something that prevents you from reaching out, especially when we're talking about topics like trying something new when it comes to opioids, or having that situation. Reach out. We want to talk. I know Joe would be happy to talk to people. Olivia would want to talk to people about the situation. There are people here who care, and it's about community. It's about communication, and that's really I cannot stress that enough. That in this situation, that it's important just to have those conversations and be honest about it. And there are people here that will be honest back and walk with you through that. I did want to ask one question on this, again, because I'm learning as we go. Fentanyl use, we talk a lot about accidental fentanyl use.
Yeah.
Is that pretty much the only, I mean, is it, if we would talk about an overdose with fentanyl, is it accidental that's been some other drug it's been added to or something like that? Or how does that really fall for a lot of, for the situation?
Yeah. So there can be unintentional fentanyl use. There can be intentional fentanyl use. So what's unique about fentanyl is that it's really lightweight and it's really easy to smuggle. So it's easy to hide in a lot of things. It means it's easy to get through, easy to get in and out of the country. So fentanyl is this really strong opiate that can be easily added to another drug. And sometimes it can be added to another drug unintentionally. For example, if all the drugs are being prepared on the same table, you have your cocaine being prepared over here, you have your heroin prepared over here, and the fentanyl is nearby, it can drift over into something else and get added to it without even the dealer's knowledge that it's happening or intention that it's happening. So, people can use it intentionally. People can use it accidentally. Olivia, maybe if you want to kind of clarify with Simon.
Simon did not want to die. He did not know that his pill was laced with fentanyl. And I think, it's important to know that a lot of people, especially at that young age, don't go into experimenting with recreational drugs wanting to die.
Right.
That's never that shouldn't be the case. And it's just tragic that their lives are taken away from this drug. And it's really a poisoning, not really an overdose, is what we've learned through the DEA, because, their lives are just kind of stripped from them because it's just so quick and so fast. And he had no intention of knowing that there was fentanyl.
And this is where the Narcan conversation is so important, because it doesn't matter if you have Narcan. Like, it doesn't matter if it was an intentional or unintentional. If the body starts to react, then the Narcan can be administered to help. And And so whether it's a situation where someone knew they were involved in fentanyl or they did not know they were involved in fentanyl, the Narcan is indiscriminate. And
Yes.
and that's kind of trying to break down that stigma again, that you're just using it just in case.
Yeah.
It could be, whether it's like, I know this is a situation where it's needed, or I'm not real sure, but I'm gonna try it anyway.
Right.
Just having that availability, and then it kind of covers all situations again, whether it's intentional or a situation like Simon where it all of a sudden something happened that was unexpected. And that's really how this conversation is helping cover all sorts of situations.
Yeah, and I would say every overdose is accidental. No one goes in using a drug thinking this is the time that it's going to prevent me from taking a big enough breath. So, we have to understand that as drugs are used, people use drugs for a variety of reasons, but there isn't a reason of I'm using this to overdose, because there's just so much stigma about drug use, and there's so much bad press about drug use that shouldn't be there. And I mean, I was talking about dealers earlier, and all the blame should not also go on dealers, because I've heard of dealers who will not sell opiates unless the person shows them that they have Narcan. I mean, that gives me goosebumps to think about. That's a responsible dealer in my mind. But imagine that kind of scenario where they're saying, no, I'm not going to sell to you because you don't have Narcan on you. You don't know how strong this drug is. So I think that's a good example of we're often looking for a villain or, this quick answer to solve an enormous problem, and when we haven't really even dealt with the source of the problem. The problem isn't drugs. The problem is that people look for ways to cope. And some ways are, all the ways of coping are going to be different for everyone, regardless of what that is. So what I am always kind of trying to do with my work is create this kind of non-judgmental, neutral space where people can talk about drug use, and we can talk to them about their drug use in a way that's free of all that stigma and judgment. To be able to say, you can do whatever you want to do. Let's make sure we do it safely.
I think it comes back to, and when you're destigmatizing anything, it's changing the scope of the conversation.
Yeah.
Instead of looking for someone to demonize or make the villain, let's just find a way to connect.
Yeah.
And to support, and whatever that means, and find out through conversation and through community and through relation, because that's really how we're going to move forward in anything, is that coming together.
Yeah.
That's really what's going to solve, whether, it's trying to figure out how to do your calc homework, or trying to figure out how to go out and have a good time,
right,
or trying to figure out how to deal with unexpected whatever came up during the semester. It's all about coming together and supporting as opposed to dividing.
Right. Or, putting negative light on something. Like, a lot of people use drugs recreationally and they're totally safe and they're totally okay and they're not hurting anybody. So, that I think we have to be also conscious in this kind of conversation about even talking about even vilifying the use of drugs. We need to talk about okay, some people might use drugs to cope with their life. We need to be respectful of someone's choice to be able to use drugs, but also raise awareness that some drugs are riskier than others. And sometimes when drugs are purchased on the street, unfortunately, you may not know what's in it. And so there's a need for better communication, better awareness, and better support of each other. If someone's like, hey, I just got these new pills of Adderall, I've never taken these types before, can someone back me up just in case? Can someone hang on the phone with me for 10 minutes? Just in case something happens.
Yeah.
So there's just this need to have a more real conversation, and we've struggled ever since the war on drugs to have a real loving, caring, respectful message around drug use.
Joe, you're talking about the conversations coming together, and there is that stigma that certain drugs are the ones we don't talk about. Certain drugs we are. I go to the doctor, I have a back spasm, they give me something for my muscle relaxer or something like that. I go home, I say, hey, I'm taking this, just aware. be aware, watch out for me if I start having an adverse reaction. And then if I have questions, I can call my provider, my doctor. I can call the pharmacist and I say, hey, what's going on? Are there places in CU? Are there opportunities? Are there resources for somebody who's like, I want to have this conversation.
Yeah.
I want to find out, what I should do or what I should look for, or someone just to support. What are some of their options in community?
Yeah, so there are a few options. They are fairly limited, but one good option is the harm reduction program that I run at Public Health. So harm reductions is kind of an old term for like syringe exchange, but it's a way to help people that are using drugs stay safe while they're using drugs. And so it's a way for us to reach out to a population that's doing something highly stigmatizing, and help them have access to health care while they're still using a drug, have access to just a friendly voice or a friendly face to be able to say, hey, how you doing today? Everything all right? You feeling all right? What can I get for you? Staying connected to people that use drugs at any stage of their drug use. So we offer clean syringes for people that inject. We offer safer smoking kits for different types of smoking apparatus that people might use, with the intention of, the folks that use drugs, not only are they, at risk for some serious diseases, but they're just at risk for healthcare not caring about them. And so we are trying to reach the drug using population to be able to say, hey, we do care about you, whether you use drugs or not, at any stage of your drug use. People often think that we're trying to get them into treatment to stop using drugs. And it's like, no, we rarely talk about treatment unless the client talks about treatment. But often we're just talking to our clients about, how you doing today?
Yep.
How you feeling? What can I get you? How's your arms? How's your shot sites? How's your lips? Do you have any burn marks that we need to look at, or maybe talk about some preventative care around those? So, do you have access to Narcan? Do you have, we now have a new shelter in CU, which is really exciting. A low barrier shelter run by the Champaign Township. Do you have a place to sleep? Do you have a place to stay? Do you have access to food? Just trying to reach people where they are, because often healthcare has a hard time reaching people when they say, I'm using drugs. Healthcare just has a poor history of doing that. And so the idea with our harm reduction program is to help meet people at that stage of using, because sometimes they need very specific things. Clean needles, access to condoms, access to mental health care, those kind of, they need specific things here that they might not be able to get that same kind of support at a hospital or an ER or a drug treatment center or something like that. So, so the hope in my program is that we can access the drug using community to provide them with kind of preventative care for any stage along their spectrum of drug use. Because the other kind of weird thing that I don't think is talked about enough is that people eventually stop using drugs. Usually they age out of them. That most people will use drugs at some point, and then at some point they will stop. Something in their life will happen, and they stop using drugs, or they seek treatment and find an alternative or something. But, we often think that when people are using drugs that they're junkies, they're homeless, they're living on the street. That doesn't happen a ton. It may be in more metropolitan areas, but I mean, even the word junkie just offends me, because it's that's not what most people using drugs look like. Most people using drugs look like everybody else. They have jobs, they've got families, they got kids, they got lives, they got school, they got parents, they got all the same things we do, but they also just happen to be using a drug at the same time. And their lives are harder than most of us, because of some drugs need to be taken every day, or people don't feel well. So I think kind of doing this work has given me a very unique perspective on drug use, and I really try and stay kind of like drug neutral. Where I think so often we're so like drug negative, like drugs are bad, don't ever do drugs. Like we know that doesn't work. So I think healthcare and the world in general needs to become more like drug neutral, meaning we're going to accept you at any stage of your drug use.
And those resources you mentioned, we will, as always, will have listed in the bio of this episode, ways to contact. You can always contact us at McKinley to try and get there as well. But Olivia, you mentioned your mother was part of a national group of that she had met with somebody. Would you want to talk a little bit about that and how you got involved, how she got involved with that?
Yeah, she went to a conference in Rosemont. She sent in Simon's photo. It was like a wall called Faces of Fentanyl for people who had lost their loved ones to fentanyl, and they contacted her and it was like a DEA run conference about everything going on and the importance of fentanyl education and Narcan education. So she met a lot of other families there that we've kind of been in contact with and have been able to kind of share stories and just relate to each other. And it's been very helpful to have people to talk to and know that I'm not alone in this, and that everyone is struggling, and that people want to help each other and want to be there for people who are going through hard things. So I think it's very important. I've kind of been I'm more of a closed off person and a little more shy, but recently I've just realized how important it was to not keep everything closed inside and share when I'm struggling. And so these last 7 months have definitely been a journey for me, but I'm just so glad to have resources and people that care about me and love me to support me through this. And it's just been great to kind of share my story with others, hopefully to inspire and educate others. So, yeah.
Kind of the common thread between what you both have just said is that you're not alone.
Mm-hmm.
No matter what you're going through, no matter what path you're walking, there are people that care, there are people that want to be there, and there is community to be found, if you would like. And we really, again, I really encourage anyone listening to find that community, to find that support. This has been an enlightening, this has been a difficult and wonderful topic at the same time to talk about. And I cannot express enough my gratitude to you both, Joe, Olivia. Thank you for coming, for being here, for being authentic, for being real, and sharing who you are and your passion. I just really appreciate you being here today.
Thank you.
Yeah, thanks for having us.
Yeah. And I would just encourage all students to take advantage of the Narcan availability here on campus, because like we all said, you never know if something will happen to you or those around you, or even if you don't feel like you're in an environment where you may need this, you never know where you may be or at a certain day or time. And I miss Simon every day, and it was a tragic accident, but if he had had Narcan available or somebody with him in his apartment, I know he would be alive today. So thanks for having me on, and this is a very important topic. So I'm glad it's getting more recognition here on campus. So thank you.
Thank you so much. The journey through college, the journey through life is full of expectations and full of plans and full of paths that we think we're going on. And sometimes those come to fruition, and sometimes those take a left turn, or you never know, and things come up. But the key to all of it is conversation. The key to all of it is community. The key to all of it is just reaching out. And so if you're listening today and you want to know more about Narcan, you want to know about opioids, you want to know more about resources, about availability, about how to prepare, how to process through whatever events you've had in your life, anything like that, I cannot encourage you enough to check out the resources we have available, to reach out to us here at McKinley at Healthy Illini. You can try and contact me directly through McKinley. I will take calls, I'll take emails, but just really encourage everyone listening to take advantage of the opportunity to get Narcan, to have it, to understand how it's used, and to have a plan in place for you, for your friends, for anyone that you come across, in order to help be a part of the positive solutions to the things that we're facing. So thank you for joining us today. You are on a personal journey no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. Go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.